Hello, we are joined today by Maureen Murphy and Lindsay Lachant, certified nurse midwives with Capital Region Midwifery. Today we are discussing water births. Good morning.
Good morning.
For those people who might be watching who might not know what a water birth is, can you describe the process and what is involved?
Well, typically midwives attend water births with women, and in our hospital we have a big inflatable pool that we bring into your room. It's about 2.5 feet deep and 4.5 feet wide, and you can submerge yourself during labor and or birth and give birth that way, and it's a warm, comforting environment.
And what are the benefits of a water birth for, not just mom but also baby?
I think most of the evidence and literature shows that the benefits are more for mom, but when mom is relaxed and calm and comforted, the baby sort of emulates the same environment that mom's in.
And are there any risks?
Very few. If we maintain the right temperature and we know that the water is clean, those are the things that we have to pay attention to. So making sure that we just use evidence-based procedures.
And are there any situations that may not be ideal for a water birth?
Sometimes, yeah, and really it's individual, and it has to do with whether or not we can listen to the baby. There are a few other reasons, but it's an individual basis, really.
And how should a woman prepare for a water birth?
At the Burdett Birth Center, you have to bring a 25-foot garden hose and a little fishnet. And all of it is single patient use, so it gets disposed of afterwards. Or I guess you could bring it home with you if you wanted to.
Yeah.
But
yeah, and
That's
I think also preparing yourself for the fact that you may or may not want to actually push in the water. So hydrotherapy is very comforting in labor, and a lot of women like it. But when it comes to the time of pushing, most women get out of the tub and push on land. Statistically anyway, for their first baby, they typically get out right before pushing, but not everyone. And we're flexible enough to allow whatever process is working or not working for women to just roll with that.
And for the women that do choose to stay in the tub and deliver, for people who might not be familiar, who might think, well, what about the baby and what about breathing? And can you describe, really that process?
Yeah, baby is actually in a fluid environment with the amniotic fluid, so the baby it's sort of passive into the tub. The temperature is supposed to be the same as body temperature, so one of the things that it's important to do is to monitor the temperature of the water about every hour and make sure it's a certain temperature. Once the baby comes out and has the air pressure hitting the chest, it sort of stimulates the first breath. So just like when it comes out into, normal on land birth, the same thing after the baby's born, comes right up, takes its first breath.
And what about, is there any is there training that is involved, or does a woman, have to go through any kind of educational process prior to having a water birth?
Just a discussion with the midwives about the process and what to expect, and that to know that there are situations where we might ask you to change position or to get out if we feel like we need, if it's safer to be out of the tub. But no formal preparation is needed.
And if the family of the woman, wants to be involved in the water birth, are there any kind of restrictions or that, or, how does that?
Not really. Yeah, a lot of partners will want to get in with moms, and that can actually be a really good thing because a lot of women can maybe rest on their partner, and that can give them a little bit more support, and we encourage that if that's what's working.
Great. All good information. Thank you so much. We appreciate you taking the time to talk about this topic today.
Thanks.